Je suis vraiment très heureuse aujourd'hui d'être ici pour le kick-off du PNC2. On a longtemps attendu le kick-off, mais je pense que, comme a dit Dr. Winterreiner, c'était une bonne période de réflexion et de mettre en main un programme qui est vraiment très ambitieux au niveau clinique et au niveau de la recherche. Je suis un peu ici aussi en tant que représentante de tous les acteurs de la recherche dans le cancer au Luxembourg. Et donc, c'est après de longues réunions et discussions qu'on est arrivé à présenter ce programme ici. If you allow, I will switch to English, and I hope to keep the larger audience on board. So the new PNC has defined three objectives in the research part, so axe 8, which have already been mentioned previously. And these concern, first of all, to focus the research in Luxembourg on translational research in clinical aspiration. Also enable novel treatments and access to clinical trials, in particular phase 1, and also foster research on prevention. So I will focus now on the indicators that we have defined in this Plan Cancer, which I think will be the basis for realizing all the other objectives that are defined in this Axe 8. So what we aim at is to set up a center of excellence in research on cancer, on translational cancer research, which then will kind of be a service provider for the hospitals and for all the stakeholders to realize the objectives defined in the Plan Cancer. Of course, this will be a virtual center. We are not talking here about an infrastructure, but a virtual center which will bring together researchers, clinicians, and patients with the aim to foster a better patient care. So you may ask, why do we need research? I know some people always ask, why do we? So I have taken a few examples of clinical questions that regularly come up in discussions with oncologists, radiation oncologists, or other caretakers. So, for example, as already was highlighted by Dr. Duhem, you want to know if your patient's cancer carries a targetable mutation, meaning a druggable mutation. And of course here, although a couple of mutations are already known and can be targeted, a lot is still unknown, and what the research site can provide is really to provide not only known sequencing panels, but to do whole genome sequencing. And as already it was highlighted before, this will now be possible at the National Center of Genetics at the LNS, thanks to the new equipment, but also to the know-how that has been established at the LNS in recent years. But nevertheless, this is a continuous process where there is a close interaction between research development and diagnostics and clinical application. So, for example, this requires strong bioinformatic knowledge. It requires development of novel procedures, and of course it needs the interpretation of the genetic data, which is not something that can be simply done with just quickly looking at the results. So this will provide treatment advice to the molecular tumor boards and the oncologist. But again, these are things that are not necessarily covered yet by regular CNS treatment. So this is also where we need the connection and the close link, porosité, that was a nice word, between the clinical and the research world. Another example, or another question that often comes up is with regard to the latest very promising treatments on immunotherapy. Why is one patient reacting very well and another patient isn't? So here we need to develop a new understanding of the immune reaction of the patients. For example, this can be done by immunoprofiling. We need to identify biomarkers for patient stratification. And of course, we also need to can do preclinical research to foster the reaction of the immune system and thereby improve the immune response. Another important topic is the consequences of radiotherapy. Radiotherapy is, of course, an extremely important component of medical care in cancer, yet it also, in some patients, goes along with strong radiotoxicity. And research, again, can help to understand the patient-specific responses. For example, some patients develop fibrosis, others don't. Some patients develop radionecrosis. So again, here, I think there is the opportunity for maybe molecular-based radiation therapy that will rely on molecular information of the patient and of the cancer tissue. And also tests will can be done to adapt or improve radiation dosing and scheduling. And I thank here my colleagues who have contributed to defining various clinical questions. So what we have noticed during the discussions is that currently within the Luxembourg system we do have a limitation in how to link the clinic and the research. So on the research side, I highlighted here the main players, which is the Luxembourg Institute of Health and the University of Luxembourg. We have strong expertise and research axis in specific topics, for example, in immuno-oncology or more broader in tumor-stroma interactions. We also have strong expertise on cancer metabolism and tumor genetics. We have specializations in certain cancers like brain cancer. Yet, if we look at project scope and funding, this normally covers very specific short-term projects which run maybe 2 or 3 years and which don't necessarily reach the clinical needs. So we have a barrier here in terms of both project scope but also in project funding. So that is why we came up with the idea to integrate this through the establishment of a national competence center or excellence center for cancer research. And this should really then bring not only people together, but really enable the interaction and set up programs that allow to address clinical questions that I just described. So how do we want to go about this? So at the very core of this center would be the cancer collection that Dr. Berchem has already alluded to. So this concerns the collection of all of samples of all tumor tissues within the country that will be centrally collected and stored, but not only stored, but also analyzed in detail through, for example, genetic profiling, functional profiling, immune profiling, We can also develop organoid models to further have patient-derived models in the lab for further analysis. And this information coming from the hospitals then can feed back directly to the tumor boards for patient treatment options. I think the impact here can be really very strong if we develop this at a national, on a national scope, because as we have seen before, this could lead eventually to the establishment of a comprehensive cancer center, which, as Dr. Bierschem also alluded to, which requires a certification not only of the clinical care, but also a strong research axis combined, and thereby allowing the access to innovative treatment to the patients. So we, in addition to this, to the, let's say, sample data and research axis, we of course need also a strong integration of the clinical data with the cancer registry, and this needs to be then also available in order to make the sample collection meaningful. And of course, additionally, any type of research projects could hook onto this center in order to develop specific projects in different cancer areas. As you can see, this is an ambitious program, and I just would like to highlight how this aligns with the National Plan Cancer. First of all, the establishment of such a center will really allow to integrate the clinical and translational dimension for oncology. It will bring all the research teams together to focus on cancer research with translational aspects. This is really at the core of the endeavor. One main pillar, as I mentioned, is the cancer collection from the different hospitals. This will be coordinated by INC together with LNS and of course all the hospitals. And here again we will provide infrastructure and expertise from LIH side and also biobanking capacity in order to enable this this process. A very important part is the clinical data that what I mentioned, and again here this is also in line with the digitalization of clinical data and really feeding the important data into the cancer registry so that it can be used for downstream epidemiology projects or also prevention projects. The digitalization of data collection can also, in addition, be supported by a research initiative called Clinova that you probably have heard of, where LIH, together with hospitals and also international partners, is driving digitalization a program for data collection of clinical samples in various diseases. And again, here the PNC can profit from these initiatives and make use of established know-how and procedures. And finally, this will lead also to enable and develop novel clinical trials in close connection with the hospitals, which will then allow access to more innovative treatment capacities for all the patients. So I think, yes, and yeah, I mentioned already the cancer registry, which really is also very important to provide input to the ministries to also evaluate the different actions that have been taken in the PNC, and that will allow to evaluate if we have made progress in terms of numbers of patients or in terms of survival of patients and hopefully also quality of life. So with that, I would like to leave you with the larger long-term vision of the axe 8 du PNC. I am not going into the details of what has already been established, but I would really like to say that we have an ambitious program, and we really would like to achieve this in the next couple of years, and really enabling a constant workflow for integrated precision oncology that goes from the clinical perspective, from the clinical needs to the bench side, to the laboratory, and feeds back into clinical decision-making processes. Here is our timeline. So at the moment, what is ongoing is the identification and alignment with clinical needs. At the same time, we also align the research focus and strengths within the community, and in order to get the most out of it. We would like to present a kind of draft proposal by the end of the year, an initiate proposal that would allow to discuss with funding agencies to seek for external funding, because of course we have great plans, but the PNC does not provide budget for our plans, at least not at the level that we are aiming at. So we will be responsible for external funding and relying on external funding in the next years. And we look really to have a long-term scope that will allow us to make a change in patient care in Luxembourg. So what is already also in progress, as Dr. Berchem mentioned, the cancer collection is already in the process of being finalized to really start kicking off early next year. Also, together with LNS, we are establishing a research pathology platform and a research genomics center, which will allow to take care of, let's say, the activities that are not purely diagnostic or that are not currently already recognized as diagnostic activities. And last but not least, we hope, of course, that there will be sufficient support, both financial and otherwise, from the different actors that are interested in getting this set up. Yes, with that I will leave you, and thank you all for your attention.